Hi, my name is Sofia Ruas, and in this video I want to talk about the needs and challenge that disaster workers face during different response phase. This is a crucial topic because these professionals work under extreme conditions that can impact their physical and mental well-being. Throughout this video, I will break down three key phases: the heroic phase, the honeymoon phase, and the disillusionment phase. I will also highlight some strategies for support and treatment to help manage the emotional and psychological effects that may arise. Okay, let's start with the heroic phase. This phase happens immediately after the disaster occurs, and this is a chaotic period where disaster workers focus on saving life and providing the immediately assistance. But what are the main needs that those workers need? First, basic resources and safety. Workers need access to medical supplies, clean water, personal protective equipment, PPE, and effective communications tools. The second one is the logistical coordination. A clear chain of commands is essential to assign tasks efficiently and maximize response efforts. And the third one is the emotional and psychological support, because exposure to traumatic events can cause extreme stress and anxiety. Let's continue with this phase, the heroic phase, but I want to talk about the challenge of this phase. The first one is the work overload. Many disaster workers endure long shifts with little to no rest. The second one is the high pressure decision making. They must make quick, critical decisions without having all the necessary information. And the last one is the acute stress and secondary trauma risk. Constant exposure to life and death situations can lead to symptoms similar to post-traumatic stress disorder. According to the American Psychological Association, social support during this phase is crucial in reducing the long-term psychological impact. Let's talk about the honeymoon phase and breaking point. After the heroic phase, many communities go through a honeymoon phase, characterized by a sense of unity and hope. Disaster workers and survivors often feel a strong sense of purpose and collaboration, of course. This phase can last from 1 week to up to 6 months post-disaster. But when does the breaking point occur? The initial optimism starts to fade when recovery efforts slow down and promised aid does not fully materialize. Let's continue with this phase, the honeymoon, but now I'm going to talk about who is most affected with this phase. First, the disaster workers. They may experience emotional exhaustion and demotivation when they realize recovery is slower than expected. And of course, survivors, they may feel abandoned as media coverage and aid organizations shift their focus to other crises. Why does this happen? Unrealistic expectations about the speed of recovery. Then, lack of resources to continue providing assistance. And then, increased stress due to the uncertainty about the future. A study by Ursano 2020 found that in this phase, disaster workers often report lower job satisfaction and higher level of anxiety and depression. Okay, let's move on with the disillusionment phase. It's one of the most challenging. Negative emotions such as hopelessness, frustration, and anger can escalate. This phase can occur from the second month up to 1 or 2 years after the disaster. But what are the common mental health conditions that can appear in this part? first one, post-traumatic stress disorder. Prolonged exposure to traumatic events can lead to intrusive memories, hypervigilance, and avoidance behaviors. The second one is depression and anxiety. Many disaster workers struggle with feelings and guilty and helplessness, believing their efforts were not enough. And the third one is the burnout. This syndrome is marked by chronic fatigue, cynicism, and a decline in a professional effectiveness. But for those situations, we can offer solution. And let's talk about treatment strategies. For example, cognitive behavioral therapy that helps workers identify and change negative thoughts patterns. Other options are support groups and community networks that encourage sharing experiences and learning copies strategies. Other option is self-care programs like doing exercise, mindfulness, and proper rest can reduce stress level. According to Bonanno 2019, disaster workers who receive early psychological support shows better long-term adaptation and lower risk of developing PTSD. In conclusion, disaster workers face multiple challenges throughout the response phases, from the intensity of the heroic phase to the frustration of the disillusionment phase. It's essential that they receive proper psychological support to protect their well-being. I hope this video helps raise awareness about the importance of the mental health care for these professionals. The reference used in my analysis include American Psychological Association 2024 Recovering Emotional from Disasters, Bonanno, Romero, and Klein 2019 Mental Health Resilience in Emergency Responders, a Systematic Review, Journal of Traumatic Stress, Needs and Challenge of Disasters, HCU Online Course Development is a video in YouTube. Also, Red de Respuestas a Desastres de North Carolina, Tipos y Fases de Desastre. And the last one is Ursano, Fullerton, and Raffle 2020, Individual and Community Response to Disasters, Cambridge University Press. Thank you so much.